Okay, we're going to get started. I think we have a full house here. This is Debbie Slutsky from the American Nutrition Association, the manager for certifications at the BCNS, which is the certifying arm of the ANA. And I want to thank you all for being here today. I want to thank Amy Smith for organizing the CNS Connect webinar series. And this is our internal from our certifications team to you, the CNS candidates. And I believe there are some supervisors here with us today talking about the Supervised Practice Experience, or SPE. And I just want to begin by clarifying that the information included in this presentation, in the reporting materials, and on our website is not for a new model of the CNS Supervised Practice Experience. Rather, the information we are providing and presenting is a confirmation and clarification of what existed before and what was assumed to have been taking place by those involved, including candidates, supervisors, supervision programs, and school courses and internship programs. So at this time, we want to ensure that supervisors and candidates are in compliance with the best practices in the field and with the common denominator for state licensing laws when applicable. This process and very high level of reporting and disclosure is imperative for CNS candidates and certificants to earn not only the CNS certification, but also the state license when applicable and required for them to practice. So again, thank you for joining me today and for all that all of you do for the ANA and for our profession. Here's my contact information. So if most of you probably have it already, but if you have any questions, feel free to contact me. And we also will have time for questions and answers at the end of the presentation. Okay, so I'm going to just start with a little bit of background. We know that nutrition holds the greatest potential to solve our society's health crisis. And there's a plethora of information demonstrating that nutrition is both the cause and the solution to the epidemic of chronic disease and obesity that we face. And yet there is such a profound gap between nutrition's potential and its actual use. Why is that? Well, the mission of the ANA is to address this by equipping all health professionals to apply personalized nutrition in practice. The ANA believes nutrition belongs at the core of our healthcare culture and system, and we envision a healthcare system that transforms the health of Americans by creating opportunities for diverse nutrition providers to practice to the level of their training. We also believe that the public should have equitable and affordable access to the nutrition practitioner. To realize this, we provide 4 key functions. We educate, we certify, we advocate, and we connect. We enable a broad range of healthcare professionals to practice personalized nutrition. Those who use nutrition as a single discipline, standalone nutritionists, and those who use nutrition as a tool to augment another discipline, such as medicine, nursing, pharmacy, naturopathy, etc. So we talk about this when we talk about personalized nutrition. And what is it? It kind of has different definitions. There's not really one definition, but we say that personalized nutrition holds the greatest potential to solve the chronic disease epidemic. And the ANA is the unified professional home for the science and practice of personalized nutrition. And our guide star is our vision for humanity. Our roadmap to get there is our mission, and the principles that drive everything we stand for and do are our values. So this is important, this concept of personalized nutrition and what CNS's practice to really understand the supervised practice experience component of earning the CNS. Oh, my bad. Uh-oh. So sorry about that. Sorry about that, guys. Okay, let's go here. So we do have just additional information and links that you'll have access to the ANA's paper. So I invite you all to follow this link and read the personalized nutrition paper that was written by a number of ANA staff and board members. And you can follow this link to do so. And so one of the pillars, the 4 pillars that I mentioned, is certify. The BCNS is the certifying agency of the ANA. And you can get to this page on our website, theana.org/certify. And the ANA offers the most rigorous nutrition credential available in the United States, the Certified Nutrition Specialist, as you all know. It's for advanced nutrition professionals. And to earn this credential, a professional must have a master's or doctoral degree, advanced coursework in nutrition science and therapeutics, and of course, complete 1,000 hours of supervised practice experience. And then, of course, you must pass a rigorous board exam. So in addition to the CNS, BCNS also offers specialty certifications such as the Certified Ketogenic Nutrition Specialist and the Certified Nutritional Genomic Specialist. And each of the certifications, in order to earn them, must complete and get approved 3 E's. And that includes the education, the experience. So each of specialty and core certifications, there must be an experiential component. And then there's also an exam, a certification exam for each. So some of you may have heard some of this information in some other presentations that we do, but I like to just include it here as well as background. Again, what are the benefits of the CNS? I know we all get a lot of questions about the differences between the CNS and the RD and some other, licenses and certifications out there. And so I like to offer some, clear just reference materials and information that you might be able to share with fellow students and colleagues, potential employers, clients, and potential clients. And the CNS offers a career path for the science and practice of, once again, personalized nutrition therapy. This career path provides many of the same benefits historically available only to registered dietitians. The CNS is the most advanced certification for personalized nutrition practitioners. So CNS professionals practice science-based personalized nutrition therapy to prevent, manage, and treat disease and optimize health. They are spearheading and the transformation from population-based to personalized nutrition and from disease care to comprehensive health care. And I like to share this information on NCCA, this logo that you see here, which stands for National Commission for Certifying Agencies. This was established in 1987 by ICE, the Institute for Credentialing Excellence. So the NCCA accreditation is the leading standard certification programs. It enhances trust in the certification to ensure the certificant is current and competent in the nutrition field. So having an NCCA accredited certification sets you apart as a qualified, personalized nutrition professional associated with other professionals in the field. And having the NCCA accredited CNS certification ensures both employers and clients that you have the highest level of credibility. So I like to share this also because we are held to these high standards by NCCA. We have to provide reporting to them just as you have to provide reporting to us. So it's very difficult to offer any kind of change in the process, exceptions to the rules. And so, a lot of times we are strict and rigorous in the process, not because we want to be or want to create, additional work for anyone, but we want to keep our NCCA accreditation, which therefore, again, only helps you having that NCCA accredited CNS. And this is something that we have available to you on our website as like a fact sheet. And you can download this and again, share with others, whether it's for clients or potential, employers, to show the differences of the CNS and the RD. And it's really the definition, like what is a CNS and how does that set you apart from some others? So before I go into some of the eligibility requirements, I also want to share with you, which, as you know, this webinar is part of the CNS Connect webinar series. So if some of you have participated in other CNS Connect activities, but just to let you know that this is the community space for CNSs and CNS candidates to find, share, learn, and connect. CNS Connect is also an initiative to bridge CNSs with the healthcare workforce and with the public. So I invite you to look at the CNS Connect section on our website, and you'll see places where you can learn about enhancing your career or using some tools like this one to kind of power your practice and share with others. And there's also a section which is called Connect with Your Community. And so, like I said, this is just one of the tools that we provide in the Catapult Your Career section. So I mentioned those 3 E's just a few minutes ago, and each of not only just the BCNS certifications, but also typically licensing requirements require these 3 E's as well: education, examination, and experience. And we just list here the details, which you can also find on the site. Many of you are working toward the degree requirement and coursework requirement. Some of you perhaps are looking, for a school or program to do this. I know we're all, at different stages in the process here. But as you can see, these are the degree requirements, coursework requirements, and then the exam and the experience is what we're going to mostly provide more detail on today. The certification exam is offered 2 times a year, typically in the fall and then in the spring, with the application deadline 2 months prior to the exam dates. So today we're at April 13th. We have the deadline for the June CNS exam is on Friday, April 15th. We always have this information on our website, which we update accordingly. And while there are resources listed on the website to help you prepare for the exam, our data shows that candidates who perform best on the exam are those who are near or who have completed the 1,000 hours of supervised practice experience, because the exam is based on clinical situations and not really facts and definitions that you can study or learn in school. And we often get asked if there's a study guide, or there used to be a primer that was available. That one has not been updated recently by ANA, so that's not really included in our list of ways to prepare for the exam. But we do recommend that candidates review the exam content outline, and then there is a reference list of books and resources to brush up on those domains and subdomains that you feel that you might need a little extra work in. And the reference list is organized by domain, the way that the exam is set up, and to suggest that you should read every book listed. But these are just references that other candidates have found to be helpful. And again, statistics show that those who have completed the 1,000 hours of supervised practice experience perform better on the exam. The exam items focus on one best answer, multiple choice questions that test skill and knowledge required of an entry-level practitioner, and emphasizes applied clinical knowledge rather than memorization or facts. Additionally, study groups are an effective way to prepare for the exam. And I talk about all this because it really does, the supervised practice experience fits into this whole process. It's a lot of folks want to just complete the master's or other qualifying degree program and then jump right into the exam while they think they are in that test taking mode. But this is why I just want to talk about the fact that those, we do find that people who are, doing the hours and participating in the supervised practice experience, you can start the process while you're matriculated in the program. Many people do start while they're in the program, but probably more than not, complete those hours after they finish the degree program. And you do have up to 5 years to complete the supervised practice experience after you take the exam. So it's not a rush. You should definitely take your time while getting the supervised practice experience. So what is the supervised practice experience that we keep talking about? And we do have detailed information on the website, which is the ana.org/certify/SPE. And I highly recommend that candidates become familiar with the requirements as soon as possible. So even if you're not quite ready to begin, well, that would probably mean you're here today. And so you are either ready to begin, or you've heard us say this before, you just know, maybe you're wanting to just be prepared. So learn about what's coming up in the process so that you, kind of do it right and get all the forms filled out and understand what is going to be expected. And one thing, it's very important that we note here and take note even that your state licensing requirements may be different than those of BCNS. So the BCNS has its own requirements to earn the CNS. That's, the first step. But for some states that have licensing requirements, that's the next step. And so the CNS is your pathway to licensure. But again, the requirements may be different state by state. And we have information in the advocacy section of the ANA website. And my colleague Tracy Hobson, who's the Director of Advocacy and Legislative Affairs, sometimes joins me in these discussions where, she really explains, how to use the map and information on the website. And one of the things that I want to share with you that she often discusses is that we have a map on the advocacy website. It shows which states are red and which are green. And it's important to note that even if your state is red, don't let it scare you away. That does not mean that you can't practice in that state. Every state has very different requirements. And so it's just really for you to know that you've got to research into what the requirements are. And while we're proactively working to help you get licensed, of course, at the end of the process, we try to require a common denominator, again, like what most states require. But definitely find out what the licensing requirements are. And that sometimes even includes the supervisor requirements. So before you even process, not only, does your supervisor meet the CNS requirements, but does the supervisor meet the state licensing requirements? So there is an application for your supervisors to fill out to ensure that you are working with approved supervisors. And I say supervisors plural because we recommend that you work in more than one setting and with more than one supervisor to cover the required competencies. The SPE, it can be very flexible, which enables you to craft an experience that meets your desired goals and will likely meet your state licensing requirements again. So there's, some flexibility, of course, but then there are also the required competencies that have to be met along the way as well. And there are two types of supervised practice experience: observational and direct client experience, which I'll get a little bit more to as we go. And then there's reporting requirements, which I'll outline more, but they include that personalized nutrition case data collection, as well as case study reports, a tracking tool for hours and competencies, and then a candidate report. And then your supervisors are required to submit separately their supervisor reports. So a question we often get asked is, what are the qualifications of hours for the field hours? Are the locations we work, people we work with, part of the equation for the hours to be qualified? And the answer is yes. The supervised practice experience must include at least 1,000 documented hours of clinical client work under the direction of a BCNS approved supervisor. And you can find the requirements for supervisor qualifications on the website. And we recommend, again, that you get the supervisor, or that the supervisor get approved prior to beginning your hours. We don't want you to begin hours and then have to do them over again if the supervisor hasn't been approved. And then you should be familiar with the required competencies, most of which should be covered in your experience. So for example, category or domain A is clinical assessment, and the competencies to be covered include things like nutrition relationship, diet and lifestyle history, biochemical and laboratory assessment, etc. So there's a whole list of what the competencies are under each category of A, B, and C. And the supervised experience may be obtained entirely or in part from your internship or residency or clinical rotation, clinical practice settings, community settings, institutional settings, home healthcare settings, or practicum as part of your master's or doctoral degree. Typically, this is only up to 250 hours in such a program. And once again, you can begin the supervised practice experience hours once you are matriculated in an MS or qualifying degree program. We recommend that you really wait until, typically at least the second year of your program, so that you have earned, the foundational courses and knowledge that you need to be able to begin to work with clients. So as I just mentioned with the categories A, B, and C, category A, is personalized nutrition assessment and interpretation, and you must have at least 200 hours in category A. Category B, personalized nutrition intervention, education, counseling, and ongoing care. You must have at least 200 hours in category B, and then at least 200 hours in category C, which is personalized nutrition monitoring and evaluation. So between 200 hours in each of those three categories, you then have a remaining 400 hours that can be covered in any of them. And so you can kind of think of it this way: in category A, the assessment, or you can think of it as the initial consultation with a client. And category B, intervention, education, counseling, ongoing care, you can think of this as designing of a plan for your client. So a candidate would be able to develop the right MNT for the health condition, make sure that there are not drug-nutrient interactions, understand the client's behavior to know what type of changes they are willing to make as you develop a plan, use of botanicals in the recommendations, et cetera. So, these are just ways of thinking what is included in that, ongoing care or category B. And then category C is that monitoring and evaluation. And you can think of this as the follow-up consultations. So category C can cover all of the competencies in categories A and B, since you would be doing and covering some of these competencies in follow-up appointments. For example, in category A, you are assessing anthropometrics, supplement use, things like sleep, exercise, and a food diary. So while you may do this, the initial assessment in category A for a client, you would also likely perform this as a follow-up in category C as well. And time spent in any of the categories may not be all the time that you're spending with the clients. So in the case of category C, regular reevaluation of treatment plan and goals in accordance with evaluation of improvements made based on symptoms and overall health status. So this includes a review of clinical research, standards of care, and other indirect contact. And if the candidate needs, if you as the candidate needs to research, let's say a supplement or a change in food, et cetera, during the reevaluation, this is time that you'll be spending in research. And I want to really clarify the research, because if it's research that directly relates to a client, something that you have found in the intake or during the assessment or intervention, then that research can be used as supervised practice experience, because it's helping you to create a treatment plan for this particular client. But if the research that you just maybe want to learn more about a particular case or a treatment, but you don't necessarily have a client that you're treating at the moment, it's great information for you and it may help down the road, but it's not part of the supervised practice experience because it's not directly related to a current client that you are working with. I have a little bit more information on that coming up. So I mentioned earlier just that there's observational experience and direct client experience. For observational experience, you are allowed up to 250 hours in this category. And this may begin even at the beginning of the degree program or even later. It could be things that, you're shadowing your experienced clinician, or next slide, I have some more examples. But I just want to point this out, that the observational experience is part of the practice experience. Sometimes you don't have any experience at all. And so before you meet, it might be best to kind of watch someone else work with a client. And then slowly, after you become more comfortable and familiar with that client, you can then begin those direct hours. So observational experience, once again, is up to a maximum of 250 hours. You may opt to start, with this. And these are just some examples, listening to videos of client and practitioner interactions. Once again, if you're working with your supervisor who's seeing clients, you can shadow that supervisor. Oftentimes, that you'll start to see a client with your supervisor, and then they may ultimately kind of pass that client on to you, and then you ultimately are working with that client on your own, and those become direct hours. So, there are some vetted school programs, supervision programs, and some parts of like coursework and clinics within MS school programs that use for these observational hours, etc. So we list some of these things here. And they're not required. You need 1,000 hours, and you can have up to 250 observational, but everyone's kind of at a different place in the process of earning the CNS and, doing the MS program. And so, for some candidates, they've already had some kind of of clients or of clinical experience. So if that's the case for you, you might feel comfortable and qualified to be able to just have your supervised practice experience all direct hours working with clients, and you may not need to have any of the observational hours. So they're not required, but they are there for those who need them. And then as far as the direct hours, again, as you become more experienced, more of the hours will be spent directly with a client or groups of clients, or in preparation for that client work. And this is referred to as direct experience. And so here you're still working with your supervisor, meeting with them regularly, getting that face-to-face or screen-to-screen client work. But anything that is directly related to your client is, experience. So again, that researching and developing client treatment plans for current clients. And so there are some of them that are listed for you here. And then just to answer, we got a lot of questions on what constitutes as hours, what counts, what does not count. So we started to list what does not count just to avoid any kind of confusion. So, if you're teaching, that is great experience for you, but that's not super practice experience. Writing books, articles, blogs, once again, maybe that's a way to get clients or to, publicize, market yourself and your practice, but it's not supervised practice experience. So I think this is just a helpful way of showing, what counts, what doesn't. So remember, this is a way your supervised practice experience, exactly what it says, for you to find what interests you. Also, you might be working with clients that you wouldn't otherwise work with, or maybe you feel like you have a niche area, but then you start working with a supervisor and their client, and you find that there's a whole other area that you might want to specialize in. So use this as part of your education and, part of the process. So we encourage you, as I mentioned before, to work with more than one supervisor and in more than one setting. This will, again, not only give you a broad range of experience, but it will also help you to meet the required competencies. So for example, if you're just working in a situation where you're working with mostly pregnant women or a fertility type of clinic, it's going to be a great experience, but it's going to be very limited to the clients that you're seeing. So that would be just one of the settings that you would get your practice experience in. And then this, of course, is probably one of the main questions that people ask, or you may be thinking now, just how do you find a supervisor? So feel free to contact Amy or myself for a list of approved CNS supervisors in your town or city or state. We also have a list of group supervision programs that we have vetted and approved. So some of you, they all kind of work differently, but some you can work remotely with them and their clients and your own clients. Networking and membership organizations, mentorship programs, your school programs, sometimes faculty and fellow student connections. Those are also great ways to find a supervisor. And so ANA has a mentorship program, and that's a great way to get in touch with other nutrition professionals and mentors. But just to clarify, not all of the ANA mentors are supervisors. They just might not meet the requirements of a supervisor. We don't have a list on the web of approved CNS supervisors for various reasons. So that's why, I definitely invite you to reach out to us and we can give you that information. But if you're not an ANA member, it's not a requirement to, earn the CNS, but there are some great benefits. So you can be a student ANA member, and therefore, again, you can have the access to the mentor programs. And you can also attend at a discounted rate the ANA annual summit, which is taking place in October, which will be virtual and in person. So it'll be a hybrid event, but that's another way to network. Not only with other students and peers, but with nutrition professionals sort of across the board and across the country. So these are great ways to find a supervisor. I guess just like anything, right? Networking is always a great way to meet people. And even if you find someone who's not a good fit for you, they may have some recommendations for other supervisors. And one thing to mention, this happens fairly often where maybe you're working in a clinic right now, and the person who is like your direct supervisor in the clinic doesn't meet the CNS requirements. So for example, maybe they only have 2 years of clinical experience, but to be a CNS supervisor, they need to have 3 years. So just because you meet the requirements doesn't mean you can't keep that position and that experience and work with that person and learn a lot from that person. It just means that you're going to have to find a second supervisor to meet with on a regular basis and to, work with and have sign off on your supervised practice experience. So you can share all of your experience and your cases, that you're doing at the clinic with that, the non-approved supervisor with your CNS supervisor, if that makes sense. So, just don't think just because you're in a situation now, it might not count. There's a lot of ways that the experience that you're getting can count. And if you have questions, you can always feel free to reach out to us. The last thing we want to do is take you away from a really good situation, for logistics. So just to let you know that. And as I mentioned a few times, and I put in bold here, it's really, or red bold, really important to make sure that your supervisor is approved before beginning the experience. We just don't want anyone to waste their time and energy and resources. And so when can you start? We encourage you to go into the supervised practice experience just, when you're ready, when you feel comfortable to start working with clients, and, get that didactic training and experience and coursework under your belt so that you have the tools to start working with clients. Okay, so how do you track and submit your hours? So there's a couple of reporting requirements. We have a tracking tool. I have the link to it here. And we've updated this a few times. Some of you have, I'm sure, heard or even worked with more than one of our tracking tools. We don't change them very often, and we don't change them to confuse you, but we change them to, enhance and improve the process. And so we do have a new version that will be rolling out shortly. And it's just going to be, a lot better and easier. It's going to be one document that is going to encompass the tracking tool and the candidates report. So keep your eye out for that. If you've already started to use the current tracking tool, that is totally fine. You can continue to do that. But if you haven't started hours, or if you're going to start to work with a new supervisor, you may want to be on the lookout for that new tracking tool. And we will have a video tutorial to go along with it. And so the idea is, like I mentioned before, when we look at state licensing requirements, or some states who have reports that, maybe is really just more, I don't want to say easier, but it just makes the process smoother if you use tools that they are more accustomed to looking at. That sometimes helps the process. So the tracking tool, it's an Excel spreadsheet with pre-entered fields and formulas. So, if you have any questions on this going forward, you can always reach out to us. Let's see. And then the candidates report, like I said, that's going to be a tab in the new tracking tool. Right now, it's a separate document. And once again, it's totally fine to use what we currently have there. We're not going to make it required that you have to use, either of the reports, just as long as you use one of them. And the candidates report is where you will kind of summarize all of your supervisors and settings that you're working. So it'll total at least 1,000 hours by categories. And it will there's also a self-evaluation part included in the candidates report. So you'll show us with, a description and explanation of activities that you've done that will prove that you have completed each of the competencies. And if you haven't gotten into the portal yet, there is a portal. It's the same ANA portal that is the BCNS portal. It's one portal on the ANA website that you just need a username and password. Once again, you do not have to be a paying ANA member to have a portal account. But you have to kind of join the ANA, but there's an option to join as a non-paying member. Of course, you can join as a paying member if you. I want to just always be very clear about that. You don't have to pay for membership to get a portal account. We strongly encourage you to keep your username and password somewhere so you don't forget, and like you do for all your usernames and passwords, I'm sure, just you want to keep that in a safe place so that you can access the portal. But this is just a screenshot of how you submit the documents, really any kind of application document. So this is where you would submit your exam application as well as supervised practice experience. So you'll go to this page where you're going to select a form. There's a drop down, you'll see candidates report. You choose that, and then you'll upload the file from your computer. So, you can get the forms anywhere on our website. They're listed in a couple different places. You don't have to be signed in or logged into your portal to access just the general, documents. So you can go to this page actually here, where you can see all of our application forms. So the candidate responsibilities, this is why, again, glad that you're attending this here with us today, and feel free to come back to this as we're recording it, but just so that you are aware ahead of time of what your responsibilities are as a candidate for the supervised practice experience. So the more information and detail on your clients and cases that you can keep is best. So we are, try our hardest to provide the tools for you to track that information. But obviously, if you want to keep other documents and files, please, of course, do that. And there may be things that you're going to have and provide and discuss with your supervisor as well. So some supervisors may require other types of documentation in addition to, what we require. But, keeping those records, meeting regularly with your supervisor. They have a training that they have to take or watch. It's a 30-minute tutorial on the responsibilities for supervisors, but it's your responsibility too to make sure that you're both complying with the CNS requirements for the SPE. Another thing that you'll need to do is disclose to your clients that you are under supervision, and while you're earning the credential, the CNS credential. You'll have to hold professional commercial liability insurance. This is very easy to obtain, not very expensive at all. So it will be in your best interest to have this liability insurance, and your supervisor will have their own liability insurance as well. So this page is on our website. That is the kind of full information of the personalized nutrition case data collection, as well as the PN case report. So in addition to the tracking tool and the candidates report, those are things that you'll submit to the CNS, but you're also required to use these two documents and review them with your supervisor. So page on the website, there are links to the case data collection and the case report. But so first, case data collection, you're going to use this tool to organize all aspects of a client to ensure that you're adhering to the PN care process. So you should use this with each client and then review with your supervisors on a regular basis. So it really provides something tangible that you go over with your supervisor, and it's very lengthy kind of intake health history form that you'll gather all this information from your client. So it will definitely help you in the whole process. And then one of these must be submitted to your supervisor as a final project along with the PN case report when you complete the supervised practice experience with that supervisor. So this is the first one is the PN case data collection. This is very similar to information that you should be gathering on all clients and entering into an electronic health record or EHR or other tools. So it's something, again, that you may have used, you might be using currently. It might be something that your supervisor requires or you're using in school. So I'm sure, once you click on the link or go to the website and see this form, it may look very familiar to what you're already, collecting. And then the other one is the case, or sorry, going back to the PN case data collection. I just have a little screenshot of it here. So as you can see, there's some instructions and objectives. We also have a tutorial on each of these forms as well. So I know sometimes it's just easier to watch, and, we outline each of the pages and information, how to fill it out. But for your PN cases, they must have occurred within the past 5 years. So, pretty much there are cases that you're working on now and, again, reviewing with your supervisor. So these are not to be submitted to the BCNS, but again, it's something tangible that your supervisor signs off on. And here's a screenshot of the case report. So I mentioned that the supervisor, does a training and that they have their own, responsibilities and forms to fill out as well. They have that supervisor approval application. So again, we want to make sure that they're approved. If they've already been approved, their approval will be accepted for 2 years. But they're still going to be required to submit a 1-page document that is called the Supervisor Approval Addendum. So we ask them to submit that to us just so that we know that, which candidates they're working with. And then, when they complete the practice experience with you, they will submit their own supervisor's report to us. And that's part of your application. So you won't earn the CNS, or we won't review your application until, their document is submitted as well. And we ask them to send it to us by email, because not all of them will have a portal account. So some important pages and links that I covered here. There's a page that's just called About the SPE Program, which is pretty much what we went over today, what the competencies are, quick the supervised practice experience. That's something that we just added that really outlines what I put here as what's observational, what's direct, what counts, what doesn't, supervisor FAQs, become a supervisor, or what's involved in the requirements for a supervisor. And then on the website, there's the application process. And so step 2 outlines the practice experience. So I mentioned before, and I just want to bring this up again, that as you're researching or just making sure that the state that you plan to practice in, that what the requirements are, if there's licensing, if there's, what the statute is there, ANA.org/advocate. And I know that Tracy is always updating that information, and she's actually got this new map and pages that is going to be a really good comprehensive list by state of just more detail. And I know she's got a few volunteers that are working diligently on this. So hopefully that will be rolled out very shortly. And I just want to mention again, or have this information here for you, the dates of the ANA Summit. So this, again, it's a hybrid event in October. It's going to be held in San Diego. And I know a lot of times, we'll have some networking things planned, but sometimes, students might get together with other students from their program, or, a number of programs if you go in person and just, get together. And another way to just network and meet each other and compare, your notes or experiences. And, it's a great way to meet people. You could also do it online, of course, as well, because there's an app with a list of attendees. And then again, just if you're interested, if you're not already a member, there is a student membership that's $40 a year. And there are some great benefits and just other ways of getting involved in the profession and the community. And that's it. So we do have a little bit of time for questions that I am happy to take. And I think Amy will be here to help monitor some of the questions that you may have.
Sure. So one of the questions was, will we be sending out the slides? And yes, we can send out the PDF after the webinar's over. I'll send it out.
Yes.
Let's see. Hannah had a couple questions about hours, and I think we might have answered them, but we'll go through them just in case. What category would research go under, and what about creating protocols?
Okay, so once again, to clarify, research has to be directly related to a current client. So that would probably go under that, probably not category A, because that's the intake. That's when you're assessing and understanding what your client's needs are. So probably go in category B or C, depending on, where you are in the treatment. So yeah, that would be, and again, just as long as you're researching ways to help your client and ways to put together a treatment plan, yeah, it would go in either category B or C.
And then she asked about, what about teaching nutrition courses or doing a group education session? Would that fall under category B?
No, so teaching courses is not supervised practice experience. So that's what I mentioned earlier, it's great experience for you, maybe a way to make money, while you're in the best teaching classes is not supervised practice experience. Sometimes if it's like a teaching, like a community like a community workshop, let's say, let's say working in a community setting or a clinic where you have clients that are attending a workshop. So you're doing the research, you're putting together a workshop for this special audience of clients. That is considered supervised practice experience. So you're educating, what their needs are, because they are like a segmented audience. Maybe they're all I don't know, any example of what they, let's say
like teaching about hypertension at the Senior Citizen Center.
Okay, thank you, Amy. So yes, if that's the case, that's a good example. So they're all interested in, it's the same topic, same subject matter, some of the same treatment that will, apply to everyone and help everyone. And then most likely you're going to follow that up with individual or smaller group sessions. So that's definitely supervised practice experience.
Okay. Sorry, Michaela asked, where do I go to get proper liability insurance before starting my hours?
I think we do have some of this information in CNS Connect. I know some of the school programs, give some suggestions. Amy, I don't want to put you on the spot, but I know that you had some suggestions of insurance companies.
There is a list on the website. Let me find the page and I will add that to the chat, but there's about 5 of them listed on that page there. So I will add that in just a second, Michaela.
Thanks.
And then Vicky asked, do you know when the blocked hotel rate will be available for the ANA conference?
I'm pretty sure it's open now. Yeah. And so definitely, make that reservation soon, because I know that the blocked rate, it does fill up. So registration is open and the hotel, block is open.
And then Vicky asked, can I start my hours while I'm taking courses? I think you said yes, but I just want to confirm.
Yes, as long as you are if the courses are in the qualifying degree program. So, if you're in an MS program that is, a regionally accredited program, then yes, you can begin the hours. If for whatever reason you're taking courses as prerequisites, then no, that, you're not in that qualifying degree program yet. Hope that answers, hope that's clear.
So Hannah wants some clarification on the group. So the group of client sessions would be category C.
If you're, kind of doing that ongoing, if it's
the follow-up would be category C, right?
Yeah.
But the initial class would be category B.
Yeah. So if it's education, counseling, ongoing care, kind of that in-between category where you're doing the work, putting together the plans, educating your clients, the meat of the counseling, program, then that would go there.
All right. I think we got to all of the questions, unless anybody has anything else.
hopefully that means that we covered a lot. I know it's a lot of information, a lot of links, a lot of documents. And that's why, again, I thank you all for joining us and, taking the time to really take it all in and, just know what there is that you have to know about, if nothing else, and that way you can come back to this. You can reach out to Amy and myself with specific questions. We have a candidate Facebook group. It's also a good place to go. Maybe I think Amy's going to put that in the chat as well. So, it's good to do this and meet others that are either in your program or other programs. If you don't know anybody in your own, program, or, just to, as peers, as people who are going through the same process, just to, bounce ideas back and forth. And that's why the mentor program is good too. Some of the mentors are CNSs, or even if you wanted to reach out or, join some of the CNS networking things that we have, because you could meet a CNS. Maybe they're in they work in an area that you're interested in, or maybe they're in your town or city or state. They are good resources as well. They've gone through the process and they can help you, along the way also.
We do have a networking event coming up on the 22nd of April. So I put the link to the webinar series in the chat there, and you can register for the networking event through that page.
Great.
All right, I think that's it.
All right. Well, thanks again, everyone. And have a great afternoon and holiday weekend. And reach out if you have additional questions. Thanks, Amy.
Thank you.
Bye.